Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's episode, we're going to be discussing a medication known as Acebutolol, or Monitan as a brand name. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only, and not to be used as a source for recommendations for your personal health care. In this video, we'll discuss the mechanism of action, or how this medication works, indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Acebutolol. We'll then discuss examples of dosing, and then finish it off with side effects with percentages. I've put together some slides to go over this information, so let's just jump right into it. So the first thing to discuss here will be the mechanism of action, or how this medication works. So Acebutolol is a cardioselective beta-adrenergic receptor blocker. It has mild intrinsic sympathomimetic activity at therapeutic doses. It reduces resting heart rate, cardiac output, exercise-induced tachycardia, and blood pressure. In terms of indications or reasons we would prescribe this medication to a patient, we may see it used in the treatment of hypertension or high blood pressure, as well as in the treatment of ventricular arrhythmia. With respect to contraindications or reasons we would not be able to prescribe Acebutolol, we wouldn't give this medication to a patient who had second or third degree heart block. Patients with overt cardiac failure would not use this medication, as well as patients with persistent and severe bradycardia, or a slow heart rate. As well, patients with cardiogenic shock would also not be prescribed this medication. Now for some examples of dosing. So in the treatment of hypertension or high blood pressure, the initial dose would be 400 milligrams orally daily. For a maintenance dose, we may see 400 to 800 milligrams once daily, or divided in 2 daily doses. The maximum dose in hypertension would be 1200 milligrams per day, and if this dose was used, it would be in 2 divided doses. In ventricular arrhythmia, the initial dose would be 400 milligrams orally daily in 2 divided doses, and the maintenance dose would be 600 to 1200 milligrams daily in 2 or 3 divided doses. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Acebutolol, so I'll go over some of those here now. A headache may happen 6% of the time, as well as dizziness 6% of the time as well. Fatigue may happen 11% of the time. Now, some more serious side effects, the following 3 happening 2% of the time would be chest pain, bradyarrhythmia, or heart failure. Rarely, patients may experience hepatotoxicity, as well as anaphylaxis. Alright everybody, that's all we're going to talk about today with Acebutolol, or Monitan. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, and most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.